Hi everyone, thanks for being here today. This is the April 3rd update from City Hall. It's kind of a big day today for information. I'm going to talk a little bit about the governor's press conference when I'm done with the city update. So the city bullet point list of changes in the last 24 hours. After coordinating with other parks and recreation organizations, we've made the decision to close the city, the public park, basketball courts and tennis courts. And we will lock those or disable them to discourage use. The group sports have just produced too much grouping up. And this is after conferring with a lot of other parks and rec organizations and how the standard has fit into their communities as well. The Civic Center Arena project continues. There are rumors going around that there's a bunch of out-of-state workers coming in to further infect us all, and those rumors are untrue. Same workers that have been there for some time. And we continue to work with Monument Health in terms of emergency planning. We have routine meetings with them. We have made them our primary advisor on mitigation efforts for this pandemic. Our rapid transit ridership is down 68%, so quite a ways. And the majority of those trips are for appointments or employment. We're continuing to monitor to see if anything should be done differently, but certainly there's a cost to discontinuing that service altogether. We're trying to weigh the benefits and the liability of doing that. Our public library is now equipped to start printing the 3D reusable masks. We're waiting to get some final plans in there to begin that. And we've been notified recently that there are emergency funds made available through the Community Development Block Grant Program. And we're going to be learning more about that, including what the allowable uses are for that. But it's related to the COVID response, but specifically we'll learn more next week on exactly how that money can be spent. The governor's press conference made available the apparent universal model now for South Dakota for projections. And this is an effort of Monument Health, Sanford Health, and Avera Health, and the State Department of Health coming together over a period of several days and comparing notes, listening to experts on modeling and projections, and have adopted a universal model. So there's a lot of information in this model, and the model is now out publicly. And so that's good and bad. It's good because you'll get to see what the state and local governments are going to use in their emergency planning efforts, but you'll also get to imagine how bad this can be once we exceed our hospital capacity, if that's going to happen. But it should be mentioned that this is a predictive model, which means it is different than a crystal ball. It does not know exactly how many cases there will be on April 12th or June 14th or any other date. It is making the best projection possible based on data available today. And the primary experts in charge of this type of projection are mathematicians. And so it is an assessment by experts in that field who are now responsible for updating the information and keeping that model relevant. So specifically, it has numbers, and I just saw a headline of a news story that I feel like is going to cause a great deal of panic, because it said up to 600,000 South Dakotans will become infected. Well, technically that's true based on what the governor's office just released. But what it says is somewhere between 30% and 70% of the population could become infected. So that's different than saying between 30 and 40% or 40 and 42%. This is a wide area guesstimate on the number of people that may become infected. So it's not fair to assume that we should prepare for 600,000. In other words, 3 out of 4 of us becoming infected. So, and the number of infections, according to the early projections here, between 265,000 and 600,000. What that really means is that there is difficulty zeroing in on an accurate estimate at this early point in time. That's what it means. There's also been an estimate on the number of hospital beds. And keep in mind, the model that you're going to see publicly is a worst case model. It is the worst case imaginable, because it does no one any good to prepare for the least case or the average between the worst and the least. So this is for us to have an accurate assessment of our hospital capacity, to build that capacity in the event the worst case projections come true. And as time goes on, starting with tomorrow, this data could change. This projection could change based on the addition of one more day's worth of data. And so imagine a week's worth of data, 2 weeks, a month's worth. This model will change. The shape of the peak may change. The date of the peak may change. It may be higher or lower. So this is a basic barometer at this point. It is not guaranteed that our peak will be June 14th. No guarantee. But this is based on the best information possible. The good news with this is that the major hospital systems across South Dakota and the governor's office have concluded that this is the best model for all of those organizations to use, and therefore the one that I think will get the most accurate and updated information. So, I just want to talk a minute about the response, the community response, both from the government and from the community as a whole. And I view this, and I watched the Mayor Tenhaken's press conference from Sioux Falls today, and I can tell that he's viewing this the same way. It's kind of uncanny that we're nearly talking about the same things every day without comparing notes beforehand. So our community is not that different from other communities. So I view this, and I think we should all view this as a continuum of strategies, a spectrum of strategies, starting with the very minimal do nothing. If we were to do nothing, that's on one end of the spectrum. If we were to do everything possible, on the opposite end of the spectrum. So you can imagine what do nothing is. Doing everything would be to bring the military into here, create martial law, not let anyone out of their homes, imprison people for disobeying. Very, very extreme. So obviously we're not going to do the extreme of that spectrum in either end. So we need to find our way along, and we've been finding our way along that spectrum. We have started out with media campaigns, bars, restaurants, recreational facilities being closed. We're creeping up on the closure of public spaces, as I've mentioned, the basketball courts and tennis courts. There are other things still on the list that could be used. We don't know if they will be used or a timeline, but some increased isolation. The governor could at any moment change course and issue a stay-at-home order or a business closure, or there are lots of options available but not in use yet. So an understanding that on the spectrum of options or the spectrum of strategies to keep this community as healthy as possible, each one of those has to be reversed at some point. At some point, we've got to come back down to the other end of the spectrum where we are doing nothing. So it's very important to understand that everything being implemented will be lifted someday. The question is when. And I'll say that the governor has made a valid point during this, and that is to really evaluate the sustainability of each measure we put into place. For example, we've closed bars, restaurant dining rooms, and recreational facilities. So is it reasonable to keep that closure in place until the last COVID-19 case has been cured? Probably not. Because there are consequences to everything. So I have a ongoing list of shared goals that I believe that everyone in the community shares, the government organizations, as well as each individual private citizen. And that is to protect our healthcare infrastructure. That's the main goal right now. We have got to protect our healthcare resources. And we do that by changing our behavior, by distancing ourselves from other people, from using extraordinary hygiene measures. That is one of the most effective tools in slowing the spread of this disease and keeping our families healthier. So the other goals are to protect critical government services. I've guaranteed from the beginning, and I'll continue to guarantee, that we're always going to have public safety, water, sewer, and garbage service. Those are the basic things we need to stay alive here, and those things are provided exclusively by the government in our area. We also have to protect critical private services such as grocery and other services that everyone needs. You could call them essential. I call them critical. And internally, we have to retool our budget for 2020 and 2021. I got a comment from a viewer the other day that no one cares to hear about the city budget. Well, maybe you don't right now, but when everything has been opened up and we're into the summer, fall, winter of 2020, and you're wondering why there are a number of city services that are not available, it will be because of the drop in revenue, the fact that in South Dakota we are not allowed legally to go into debt to balance our budget, and so these things do matter to the community. The public engagement and public cooperation is a big goal here. It's my goal and the city's goal to keep everyone informed to the extent that they find it useful. If everyone's just hearing this as white noise and no one wants to hear it anymore and our viewership goes down and down, obviously we're going to adjust to some of that. But it's so important for us to be communicating in real language what our needs are, what the community needs are, and to ask the public for cooperation. There are still cases of people being way too close to each other. And there are still too many people getting bored at home and going for drives and walking through the some of the stores just for something to do. One of the tools available to us is to start limiting occupancy of businesses. We think that that would be best done by the consumer and by the owner of those businesses at this point. Another goal is for us to provide human service assistance. That's just not a city goal. That's a goal that's shared by the community. There are people out of work. I mentioned yesterday our unemployment is at 5% and climbing. That means there are going to be folks that don't have enough food in their fridge or pantry, and they're going to need some options. That means donations of food and donations of money or time to some important services we have here, like the Cornerstone Rescue Mission, who is shutting off public meals today because of the lack of food, who's shutting off new occupancy because they don't have a way to isolate members, guests there at the mission who are feeling ill. So they're shutting that off. That can be reversed, in my mind, by people of this community stepping up with some donations and to learning what the needs of the mission are and reversing some of that. So all of us have some obligation to provide human service assistance. We have to stay calm and be kind and be patient. I, as much as anyone, knows how people act under stress. We get excited. We bring our anxious baggage into conversations, and we sometimes unload on unsuspecting people. I can tell you, I will tell you about this terrible email that we got from the last council meeting where our finance officer read 100 emails. And she was criticized in an email for mispronouncing a word. And this person who wrote the email just went on and on about the uneducated people in Rapid City and how ridiculous it is. And there's just no call for that. That didn't help that person feel better. I replied to the email, assumed it was based on stress, and it wasn't. She's just an angry person right now. So that type of thing only takes us backwards. Stay calm, be kind, be patient. Nobody likes this. No one is enjoying this right now. And we have to be able to balance the health implications brought on by a crumbling economy. I assume you know this, but poverty has as many health implications as a virus does. Folks that can't eat, the stress brought on by the uncertainty, the mental health aspects. We cannot lock this place down for the next 6 months like a ghost town and expect to come out any better than we would have now. So when we're talking about the economy and we're talking about opening back up at some point, we're not talking about acceptable losses with this virus. It's just not realistic for us to put all of our tools in action all at once to try to keep us healthy when we know that we can't reach that goal anyway. So I'm asking everyone watching, everyone in the community, to just, let's get on board with each other. We're going to fight together, and we're going to rebound together. That's the only way we get through this. We got to decide we're on the same team, rather than being a bunch of individuals, all with differing opinions, and all with growing frustration over what's happening. We're still in the beginning of this virus. I think we're going to get to the middle of it very quickly, but we've got to stick together. We are working on, through our communications director, working on a story or a listing of awesome community efforts to help us through this. And we're going to present that as a good news story and to just show that there's another side of this. Give us 5 minutes not to worry about what's going on in the world. So with that, I'll open up for any questions from the media.
Going back to the closure of the basketball and tennis courts and city parks, when is that in effect?
That'll be in effect today, and it'll take us a while to disable or remove those basketball hoops and take those measures, so that's intended to be in effect today. Sorry, the question was, when will the tennis courts and basketball courts be closed? So, yes.
What is your reaction to the governor's statement? South Dakotans will have to sustain this lifestyle.
Well, I think that's partially correct. That's a correct assessment from what we know on April 3rd. And the governor has clearly articulated that whatever measures we put into place must be sustained, and she's asking if people are willing to or able to sustain lockdowns and that sort of thing. I think this, like many other things, we'll know what the duration of it was when it's over. That'll be the only thing we really know for certain at that time. The rest is projections. But the social distancing, staying away from people, I imagine we're going to be doing that for months. And I just don't see any way around that. As far as business closures, as far as that type of thing, I think we're going to have to take that day by day. The first day we'll readdress that as Monday the 6th of the City Council meeting, when the council has to decide whether to renew the closure period or let it expire.
Speaking of the meeting on Monday, do you foresee any formations of maybe amendments to the existing ordinance rather than just an extension or an expiration? Do you see any of that, or have you had any discussions with city officials about any needs to amend the current ordinance?
The question was, for Monday night's meeting, is there talk about amending the current ordinance as opposed to just extending it? I have not heard any of that type of conversation among the city council members that I've spoken to. None of them have come to me proposing this. We do have a community outcry for the closing of things like salons and barber shops and that sort of thing. And they seem to be waiting for the government to do that. But I wouldn't be surprised if some amendment is offered or some discussion is offered on that. But I think for this, at this early stage, my inclination would be that it's going to get a simple consideration over extending it or not.
And then along with the city parks closures, is that going to be something similar to the ordinance? Is this going to be reevaluated throughout the summer months, and whether or not it's going to be open again?
The question was, will the city parks be reconsidered along with the ordinance, or will it be on a different timeline? First of all, the city parks are not closed. The playground equipment is closed. The basketball courts are closed. The tennis courts are closed. The track and field at Sioux Park and the soccer is closed. But there's, as of today, there's lots of park space, lots of miles of walking trail. And I think we'll just consider that separately from the city ordinance. The ordinance is very specific on what it addresses, and the parks are not in that ordinance.
If this continues this way, if places like Jimmy Hilton Pool also going to be included in those closures?
I think it's a little early to say, but I think one of the possibilities we need to be prepared for is that we don't even open the city pools this year. Not only will we, well, we're having a hard time understanding where we'll be as far as the disease goes in June when they would typically open, but also financially speaking, even with the user fees, those pools cost taxpayers money every year. And we're going to be in the business of saving up money enough to get us through the end of 2020. So while no determination has been made as of yet, and probably won't be made until late April or early May, it's possible that we won't open some city facilities, including the pool.
Backing off what Nathan had asked, if there are amendments made, those would also require a second reading, correct, before they'd be added and approved?
That's a good question. The question was, will amendments to the ordinance require a second reading? At the last city council meeting, the council held the first reading of an ordinance that would allow the emergency ordinance to be modified through a resolution rather than another city ordinance. So that would allow modifications to that ordinance with one reading. The second reading of the ordinance revision allowing that will be Monday night. Yeah. Any other questions?
Mary, you did make mention of the situation with the homeless Cornerstone Rescue Mission. Yesterday in your conference, you spoke about that there are still some steps that are being taken right now. You made mention that the mission is closing basically for new intakes today. Do we have any emergency protocols right now in place where the city may have to step in to provide facility? I know you had a little discussion of that yesterday.
The question was, does the city have an emergency contingency for the mission closing to new guests or for some other type of housing of the homeless during this period? That's a very complicated question. Looking at it from a very simplistic view, it seems like all we need is to commandeer a hotel or use an abandoned store and put some cots in so that people could sleep indoors. That's very simplistic and idealistic. The truth is the homeless population is divided into groups, categories, and there is a category of homeless that would be appropriate for that. Folks who are not addicted to alcohol or drugs, who are trying or who have a disability or an illness that prevents them from making it fully on their own, that would be appropriate. There's another segment of the homeless population that is addicted, and they cannot stay in the same place all night because they need that fix before morning. And we've seen this, I've seen this in my career for 30 years. We still see it every day here in the community. When you wonder, when you're panhandled downtown or some other place, someone wants some money for food, many of those individuals are intoxicated, which means they're not going to go to the mission because they can't leave and come back throughout the night. It's a very difficult situation, and it's a real, I think, accurate and unfortunate testament to the human condition. We have all types of challenges when it comes to human services and dealing with the variety of needs that we have in a community. So there's not an easy answer to the question, but emergency space has been a conversation that we've been continuing over the past few days. And but for my input, I think it would be best to start providing what the Cornerstone mission needs to operate safely, because they're trained to do it, they're the professionals, they have the facility, and so rather than reinvent that and try to do it on our own, I think that's the route we would take. Any others? Not, thank you for being here again today. No press conferences on Saturday, Sunday. We'll pick back up on Monday, and thank you.